So the body system that is very closely tied to the circulatory system is the lymphatic system. The lymphatic system is a network of vessels, nodes, glands, and organs that carry a clear fluid called lymph. On diagrams, lymph is often colored green, and it's considered a part of both the circulatory system as well as the immune system, which we'll be talking about next in this unit. So as said, lymph is a colorless fluid. It contains excess extracellular interstitial fluid. And when we say extracellular interstitial fluid, we're referring to fluid that's found between cells. And so in that fluid, there are also white blood cells. The functions of lymph are to return fluid to the circulatory system through the subclavian vein near the heart. It makes sure that we maintain a proper fluid balance, and it removes bacteria and other particles from the body. Lymph vessels are thin-walled vessels that have a very similar structure to our blood vessels. They contain valves like our veins do, and lymph capillaries are slightly larger than our vascular capillaries, or the capillaries that carry blood. They function in the propulsion of lymph, or the movement of lymph through the body. So from lymph capillaries, the lymph will then travel to a lymph node and eventually to the subclavian vein, where the lymph then is put back into the blood supply. Lymph nodes are small glands located throughout the body that filter the lymph. Functions: they store white blood cells, and since they're filtering the lymph, they accumulate debris. They accumulate things like bacteria, other kinds of pathogens, maybe viruses, fungi, as well as dead and diseased cells. And then we have lymphatic organs, organs that also function in the lymphatic system. The spleen is a blood filter, and it helps to create special cells that fight infection. The thymus, or the thymus gland, stores special white blood cells and then prepares them to become active if there is an infection that needs to be fought off. And then tonsils and adenoids. These are large clusters of lymph cells found in the pharynx, or in the back of the throat. And these are often our first line of defense, since many pathogens enter through our mouth and our nose. So there is the spleen. There is the thymus gland. And those are the tonsils and the adenoids. Tonsil grading is used to determine tonsil enlargement compared to normal, and is often used in determining the need of a tonsillectomy. So oftentimes tonsils become enlarged, and it can cause breathing problems, and it can also cause some infections. And so oftentimes, especially children, will have their tonsils and maybe even their adenoids removed. So capillary filtration is a function of the lymphatic system. It's a normal part of blood circulation, and this is when plasma leaks from the capillaries. Most plasma that leaks is reabsorbed directly into the blood vessels, so it leaks out and then is reabsorbed right back in. Any remaining plasma that stays out is then the interstitial fluid. It's fluid that is accumulating between the cells. And so then that fluid that's accumulating, the interstitial fluid, is then going to be picked up by those lymph capillaries. So in terms of immune function, The lymphatic system offers defense against disease. It helps to filter pathogens from the blood. That's what the lymph nodes are doing. And then it also contains white blood cells, which can use the lymphatic vessels to move from interstitial spaces back into circulation. And so that allows white blood cells to be able to fight off more infections than just infections that might be located within the blood. Lymph nodes, again, are small glands that filter lymph and store the white blood cells that are located throughout the body. The largest concentrations of lymph nodes are found on both sides of the neck, in the armpits, the lower abdomen, pelvis, and both sides of the groin. Sometimes you'll have swollen lymph nodes, and our lymph nodes will swell in response to an infection in the area they're located. So if you have a respiratory infection, then the glands in your throat will often become swollen. They swell because they accumulate bacteria, viruses, abnormal or diseased cells. They're also swollen because more immune cells are going there, and they're also accumulating waste. So swelling is a sign that they're actually working. And that means that they're filtering pathogens before those pathogens can start infecting other parts of the body. A condition that has to do with the lymphatic system is edema. Edema is when there's excess interstitial fluid or lymph collecting in the cavities or tissues of the body. And edema often happens because of blocked lymph vessels. And so this will cause swelling in the area that the fluid is accumulating. Edema is categorized in different stages. Stage 1 would be the least severe, and stage 4 would be the most severe. Blisters also have to do with the lymphatic system. When we have a blister, it's a small pocket of fluid that forms within the layers of the skin. And it often results from tears between our different skin layers. So we have 3 different skin layers. We have our epidermis, dermis, and hypodermis. And oftentimes, if there's tears between the dermis and the epidermis, that will fill with that interstitial fluid. Blisters and this tearing between those skin layers is often caused by forceful rubbing or friction, burning, freezing, or exposure to infection. Oozing scrapes, these are often called weeping wounds because they seem to be oozing a fluid. They produce something called serous exudate, and this is when that interstitial fluid is leaking out of the skin. And it's a normal part of wound healing. It keeps the wound moist, it supplies nutrients to that area that's healing, and it provides the best conditions for new tissue formation.